Welcome back guys. Now in this video, let's discuss about calcium homeostasis. Meaning, what are the different hormones which are trying to regulate the blood levels of calcium? Okay, what are the different hormones which are trying to maintain the blood levels of calcium? See here, I will be showing you a comparison table. Okay, here there is a comparison table. You can clearly see parathyroid hormone, vitamin D, that is the most active form of vitamin D called as a calcitriol, and calcitonin. These are the three hormones which are helping in the maintenance of calcium homeostasis. Okay, in a recent exam this question was there. All of the following hormones are involved in calcium homeostasis except. So you should know what are the three hormones which are trying to maintain the calcium homeostasis. It is parathyroid hormone, vitamin D and calcitonin. What they are doing? Look, what is the source? First look at the source. From where this parathyroid hormone is coming? Parathyroid hormone is coming from the parathyroid gland, the chief cells of the parathyroid gland. And vitamin D is getting activated. Vitamin D activation occurs where? Vitamin D activation occurs in the kidney. Okay, in the proximal convoluted tubule of the kidney, the vitamin D activation will occur. The most active form of vitamin D is called as a calcitriol, also called as 1,2,5-dihydroxycholecalciferol. Okay, next from where this calcitonin is coming? Calcitonin is coming from the C cells, not chief cells, C cells of the thyroid gland. Already have discussed in the thyroid gland physiology. Thyroid gland contains two cells called as a follicular cells and parafollicular C cells. These parafollicular C cells are the ones which produces the calcitonin. Okay, so source completed. Now, what they are trying to do with the calcium? Look guys, see the trigger. First time trigger, or you can say the stimulus. What is the stimulus for the release of this parathyroid hormone? When do you think the parathyroid hormone is released? So, parathyroid hormone is released whenever you are going into hypoglycemia. Sorry, not hypoglycemia, hypocalcemia. So, whenever your calcium levels are decreasing, it's our parathyroid glands, the four parathyroid glands, they are always sensing the calcium levels. So, whenever the calcium levels are going down, so that's the stimulus for the parathyroid gland to release parathyroid hormone. Okay. Then what is the stimulus for the activation of vitamin D? The stimulus for the activation of vitamin D is also same hypocalcemia. Whenever your calcium level is decreasing, again vitamin D activation will occur in the kidney. And parathyroid hormone also, see the same parathyroid hormone, this parathyroid hormone, it is the one which helps in the vitamin D activation. Again I will explain this in the topic of renal physiology. In the renal physiology, in the activation of vitamin D topic, there again I will explain there. Okay. So tell me, what is the stimulus for the activation of vitamin D? Hypocalcemic condition or parathyroid hormone? Done. Then what is the stimulus for the release of calcitonin? Calcitonin, exact opposite. Calcitonin is released whenever your calcium level increases. See, whenever you are having low calcium, parathyroid hormone is produced. Whenever you are having high calcium, calcitonin is produced. Because parathyroid hormone, calcitonin, they are antagonistic hormones guys. They act in opposite way. Okay. Look, once parathyroid hormone comes, okay, parathyroid hormone is there. What this parathyroid hormone is doing? Look, on bones. Okay, what parathyroid hormone is doing? Parathyroid hormone activates the osteoclast. Activates what? Osteoclast. So now this osteoclast, what they will do? Now parathyroid, actually to be very frank, first the parathyroid hormone activates osteoblast. Now the osteoblast produces something called as a rank ligand. So rank ligand will go and activate osteoclast. So again I am repeating, first parathyroid hormone activate osteoblast. Now this activated osteoblast will activate osteoclast. Now what this osteoclast will do? The osteoclast will cause the bone breakdown, bone resorption. So now who is going to be released into the blood? Calcium and phosphate levels are going to be released into the blood. Okay. So calcium and phosphate release into the blood. Fine. Next, what is the action of vitamin D? Okay, what vitamin D do to our bone? So vitamin D helps in the bone formation. Okay, helps in the bone mineralization. Done. Next, what is the effect of calcitriol? See, I have told you parathyroid hormone increases the bone resorption. Calcitonin decreases the bone resorption. Parathyroid hormone wants to move the calcium into the blood, but calcitonin doesn't allow the calcium to come into the blood. Okay, exactly opposite. One will increase the resorption, other will decrease the resorption. Done. Next, what is the effect of these hormones on the kidney? Okay, kidney. See, calcitonin doesn't have a major effect. Now, let's see what parathyroid hormone and vitamin D are doing. Parathyroid hormone increases the calcium reabsorption. Two things very important guys. Parathyroid hormone always wants to increase your calcium levels in the blood. Always wants to decrease the phosphate levels. Parathyroid hormone, you can remember like phosphate trashing hormone. Phosphate trashing means you are kicking the phosphates into the trash. So phosphate trashing hormone, you can remember like that. Okay. So what it is doing, parathyroid hormone, later I will explain you in detail. When parathyroid hormone acts on the DCT of the nephrons, more calcium is reabsorbed. But when the same parathyroid hormone acting on the PCT of the nephrons, phosphates will be excreted. See, there is a decrease. The symbol is important. Increase calcium reabsorption, but there is decrease phosphate reabsorption, or you can say phosphate excretion, sir. Increase phosphate excretion. Done. Then, what is the effect of vitamin D? See, vitamin D, it increases both calcium and phosphate reabsorption. Both same way. Increases the calcium absorption as well as the phosphate absorption. Both increasing the calcium reabsorption as well as the phosphate reabsorption. But parathyroid hormone is different. Parathyroid hormone only takes the calcium, but kicks the phosphates away into the urine. Done. What about the intestine? See, in intestine, what this parathyroid hormone is doing? See, parathyroid hormone directly it won't act. Previously, I have told you, parathyroid hormone helps in the vitamin D activation. Parathyroid hormone helps in vitamin D activation. So, yes, parathyroid hormone acts on vitamin D. Activate vitamin D. What this activated vitamin D will do? Activated vitamin D, it will go to GIT. Helps in the absorption of calcium and phosphates. So, this vitamin D increases the calcium and phosphate absorption. Don't confuse. Here the word is reabsorption. Here the word is absorption. So, the vitamin D, listen, vitamin D increases the calcium and phosphate absorption in the GIT, increases the calcium and phosphate reabsorption in the kidney. Okay. Next, look at here. In intestines, what this parathyroid hormone is doing? Directly it's not doing anything. See, it acts indirectly. How? By increasing the vitamin D. Parathyroid hormone activates the vitamin D. Vitamin D will go to the GIT. In the GIT, it helps in calcium absorption as well as the phosphate absorption. Done. And calcitonin doesn't have any effect on the GIT. Okay. Now, what is the final result, sir? What is the final result? See, finally at the end of the day, parathyroid hormone increases the calcium, decreases the phosphate. Increase the calcium levels, decrease the phosphate levels. What about the vitamin D? Vitamin D increases both calcium as well as phosphates. But what about the calcitonin? Calcitonin decreases both. Calcitonin decreases the calcium levels as well as the phosphate levels. Mainly, it decreases the calcium. It decreases the calcium. So, with this, what we have completed? We have completed the comparison. Okay, what are the three important hormones? The three important hormones responsible for the calcium homeostasis. Now, let me explain you a few more important points about the bone. Guys, imagine here is your bone. Let's say here is your bone, guys. Okay. Now, in your bone, how many types of cells are there? There are two types of cells. See, this first cell which I am showing you. Okay, this is a good cell called as osteoblast, which helps in bone formation. Okay, let me write here. This is osteoblast. And this cell which I am showing in the violet color, let's say this is osteoclast. Okay, one is osteoblast, another is osteoclast. Osteoclast. Now, osteoblast always helps in bone formation. Helps in bone formation. Then what about the osteoclast? Helps in bone breakdown. Bone resorption. Actually, in our body, both bone formation and bone resorption, both are happening. Physiologically, both are happening. Now, let me tell you. So, whenever there is parathyroid gland, let's say parathyroid gland is producing which hormone? Parathyroid hormone. See, the parathyroid hormone will come and act on osteoblast. So, now tell me, where are the receptors of parathyroid hormone? The receptors of parathyroid hormone are present on osteoblast. So, first parathyroid hormone will come and stimulate the osteoblast. Now, once this osteoblast is activated, it will help in bone formation. Okay. But this activated osteoblast also produce a chemical called as a rank ligand. Okay, something called as a rank ligand. Now, what this rank ligand will do? This rank ligand, it will go and activate osteoclast. So, now, listen carefully. It's the osteoblast which is activating the osteoclast. It is the osteoblast telling the osteoclast to do the bone resorption. Okay, at the same time, bone formation is happening and some amount of bone resorption is also happening. Okay, physiological levels. Now, once this osteoclast is activated, it will do the bone resorption. Okay. Now, see, in a reproductive age group female, okay, in a female in her reproductive age group, in her body, there are good amount of estrogens. Okay. So, there are good amount of estrogens are there. Now, these estrogens, they will help in the production of a molecule called as, okay, these estrogens, what they will do? They will help in the production of a molecule called as osteoprotegrin. Protegrin. something like osteoprotection, osteoprotegrin. So what I'm trying to say, in a reproductive age group female, there are a good amount of estrogens, there are a lot of follicles, the follicles are producing the estrogens, and estrogen helps in the production of osteoprotegrin, a molecule called as osteoprotegrin. See, this osteoprotegrin, what it will do? This osteoprotegrin, it will come, okay, it is coming, and what it will do, it will sit in between them. See, it is coming and it inhibits the rank ligand. So it is inhibiting the rank ligand. So now, in a female who is having good amount of estrogens, there is something called as osteoprotegrin. Osteoprotegrin inhibits which ligand? Rank ligand. Whenever the rank ligand is getting inhibited, now what will happen to the osteoclast? Osteoclastic activation is reduced. There is reduced activity of the osteoclast. And what about the bone resorption? There is less bone resorption. There is less bone resorption. So whenever there is less bone resorption, yeah, that's actually good because the bones will be stronger. I am not saying there is no bone resorption. There will be less controlled activity, less bone resorption. Okay, so there will be stronger bones. But what happens in the menopause? See, during menopause, that is not reproductive age group. Now we are entering into menopause. So during menopause, all the follicles are completed. In the ovary, there is empty ovary, guys. There is no more eggs, no more follicles. So when the follicles are not there, do you think estrogen is produced? No, estrogen is not there. Without estrogen, osteoprotegrin is there? No osteoprotegrin. Without osteoprotegrin, do you think this rank ligand will be ever inhibited? Is there anyone to inhibit this rank ligand? No, rank ligand is not getting inhibited. Okay, rank ligand is not getting inhibited. So what this rank ligand will do? Rank ligand will go and activate the osteoclast. So what happened to the osteoclastic activity? Osteoclastic activity will be more. So when compared to the reproductive age group female, the osteoclastic activity in the menopausal female will be more osteoclastic activity. So what do you think will happen to the bone resorption? There is going to be more bone resorption. Whenever there is more bone resorption, the bone mineral density will gradually decrease. That will lead to osteopenia and osteoporosis. Okay, there will be osteoporosis, means the weak bones. The bones are going to be weak, brittle bones. So they can undergo easy fracture. Okay, they can undergo easy fracture. So what I am trying to say finally, in a female who is in her menopause, no osteoprotective activity is gone. The estrogens are gone, osteoprotective activity is gone. So there is excessive amount of bone resorption that can lead to osteoporosis and fractures. Okay. Now, which fractures are most common during menopause, guys? Which fractures are most common? It's in a postmenopausal female, it's a vertebral. Compression fractures. It's not the hip fracture or the radial fracture, it's the vertebral compression fractures are most common fractures. Vertebral compression fractures are the most common fractures. So now you tell me how to treat this osteoporosis, how to treat this female, a female who is having osteoporosis in her menopause, how to treat. Now you tell me who is the villain in this? Osteoclast. So osteoclast is the one which is causing the bone resorption, right? So let's kill the osteoclast. Okay, let's eliminate the osteoclast. There are drugs called as bisphosphonates. Okay, let me write bisphosphonates. Okay, so these bisphosphonates, what they will do? They will kill or causes apoptosis of osteoclasts. So there will be decreased bone resorption. Okay, so whenever we decrease the bone resorption, that is actually good. Okay, again the bones will become strong. So these bisphosphonates are considered as a drug of choice for the treatment of the postmenopausal osteoporosis, especially in females who are above 60 years of age. Especially in females who are above 60 years of age, the drug of choice will be bisphosphonates. Bisphosphonates. What else you can use? See, there are drugs called as SERMs. S-E-R-M-S, SERMs. Okay, not sperms, SERMs. That is selective estrogen receptor modulators. Okay, selective estrogen receptor modulators. Example, raloxifene. Okay, raloxifene. See, this raloxifene is nothing but selective estrogen. Selective estrogen. So this raloxifene is nothing but an estrogen. What it will do? Acts like estrogen on bones. Acts like estrogen on bones only. Okay, not on the breast and uterus. So on the breast and uterus it acts like estrogen antagonist, but on the bones it acts like estrogen. So tell me, estrogens are good or bad? Yes, estrogens are good. That too, it's a selective estrogen. It's acting like a estrogen only on the bones. So estrogens are osteoprotective. So it's going to cause good thing. So yes, raloxifene, which is a selective estrogen receptor modulator, can be used in the treatment of the postmenopausal osteoporosis because it acts like estrogen only on the bones. So there is no risk of breast cancer. There is no risk of uterine cancer. If you use natural estrogens, the natural estrogens can cause the breast cancer, can stimulate the breast and can lead to breast cancer. The normal estrogens can lead to endometrial proliferation, endometrial hyperplasia that can lead to cancer. So now I am using not a natural estrogen but a selective estrogen which will only act on the bones, that is raloxifene. Okay, so these drugs can also be used. And one more drug which is called as a denosumab. What exactly is this denosumab? See, it is ending with the word mab. Anything which ends with the word mab, they are monoclonal antibodies. They are monoclonal antibody. So this denosumab is actually an antibody. It's an antibody drug. What it will do? So what this antibody is attacking? These antibodies will inhibit, this denosumab, it will inhibit rank ligand. It will inhibit rank ligand. So now, do you think rank ligand will be available? No, no rank ligand. Without rank ligand, what do you think will happen to the osteoclast? Osteoclastic activity decreases. What do you think will happen to the bone resorption? Bone resorption decreases. So that's actually good. So denosumab is acting like osteoprotegrin. Denosumab is inhibiting the rank ligand. So osteoclastic activity decreases, bone resorption decreases. So denosumab can be used. So they will ask you which of the following monoclonal antibodies used in the treatment of osteoporosis? Omalizumab, bevacizumab, denosumab. Denosumab is the answer. Okay. Next, one more drug I am teaching you, that is strontium renalate. Strontium renalate. So what this strontium renalate is doing, very important for your exam. This strontium renalate, it is having two hands. Let's understand, it is having two hands. Means you can say two functions. With one hand, what it is doing? It is activating osteoblast in our bone. With the other hand, it is inhibiting the osteoclast. With one hand, what it is doing? It is activating the osteoblast. With the other hand, it is inhibiting the osteoclast. So now tell me, whenever the osteoblasts are activated, there is increase. Okay, there is increase bone formation, which is actually good. Okay, when the osteoclasts are getting inhibited, what will happen, guys? There is reduced bone resorption. Okay, so now they will ask you, tell me what is the one drug? What is the one drug acting both by increasing the bone formation as well as decreasing the bone resorption? The answer will be strontium renalate, very important for your exam. Okay, done. So with this, what we have completed the, what are the different hormones or vitamins which are regulating the blood levels of calcium, and also I have explained you here why estrogens are helpful, why estrogens are osteoprotective, what are the different types of cells, how estrogens regulate the bone resorption. Okay. Now last point which I want you to know is, see, this vitamin D, it acts like a hormone, guys. Okay, vitamin D, it is having a lot of metabolic functions. See, it is maintaining the blood levels of calcium, it is maintaining the blood levels of phosphates. So they will ask you, vitamin, which of the following vitamin acts like a hormone? Vitamin D. Okay, vitamin D, these days it's considered almost like a hormone. Vitamin D acts like hormone because it's having a lot of metabolic functions also. Not only just this calcium and phosphate regulation, other important functions are also there. Okay, so with this, successfully we have completed the topic of calcium homeostasis. Hope the video is helpful. Thank you.